Hey, this is part 2 of Diabetes, Dr. Mcdougall's book, The Doctor Who Fought for You, written here by me, Pete Rogers. Okay, so we'll start out. We finished up with the Nathan Pritikin joke last time. He said 100% of Americans are diabetic after dinner, meaning that they eat high-fat dinner, so they test positive on the oral glucose tolerance test, whereas in the morning when they're routinely tested, they fasted overnight, and they don't usually test positive unless they really have diabetes. Okay. In 1932, Dr. I.M. Rabinowitz in Canada wrote about the benefits of high carbohydrate diets for treatment of type 2 diabetes. Okay, here's the reference right here. Over 500 patients put on this diet, and he said there were only 16 failures of treatment, which in his opinion was highly satisfactory. That's extraordinary. Remember, medicines never cure the patient. The cure rate for pills is 0%, and for insulin injections. Okay, next one, 1940, by Hemsworth. The same patient was fed 2 different meals, and their blood glucose was then checked about every 10 minutes for 3 hours. After eating a high-fat meal that was low in carbohydrate, the patient had a markedly elevated blood glucose level known as impaired glucose tolerance. When the same patient ate an equicaloric, same amount of calories, high carbohydrate, high in carbs, low-fat meal, their blood glucose level was much lower. They had improved glucose tolerance. Yeah, because the fat gets into the skeletal muscle cell faster than does the carbohydrate, and it causes insulin resistance. It causes, nutrition overload, if you will, so that the glucose type 4 transporters sitting in the cytoplasm do not go up to the plasma membrane, and then you can't get the glucose into the cell. Whereas the fat can get into the cell even without a transporter. It can do this like flip-flop maneuver across the plasma membrane of the skeletal muscle cell. Okay, next reference, Wolpert. Dietary fat acutely increased glucose concentration and insulin requirements in patients with type 1 diabetes. Okay, next reference, Brunzell. Improved glucose tolerance with high carbohydrate feeding in mild diabetes. So you're going to see that pattern repeats itself over and over and over. And you know that guy from Mastering Diabetes, that Cyrus Kumbada, in his research, he said, you want to cause diabetes in an animal, you feed it a high-fat diet. Okay, all right, I got to move this page a little here. See if I can scoot it over a little bit. Okay, omega-3 supplements worsen type 2 diabetes. Yeah, because there's this big push to recommend everybody go on omega-3 supplements, but you don't look at it carefully. Number 1, it's 100% fat. Number 2, the more fat you eat, the more likely you are to become fat. Number 3, it increases insulin resistance. Number 4, it increases your total cholesterol, LDL cholesterol, so that's an atherogenic risk factor, even though it does lower triglycerides. Number 5, omega-3s cause immunosuppression. Number 6, they're associated with increased risk of prostate cancer, which would make me think they're probably associated with increased risk of breast cancer, even though I haven't looked for a paper on that. Usually something that increases prostate cancer will increase breast cancer because they're both estrogenic chemicals. Okay, then the other thing is they increase the risk of atrial fibrillation. I've seen like 3 papers on that recently. So what am I trying to say is, if a food increases your risk of diabetes and obesity and atherosclerosis and immune suppression and total cholesterol and cancer and atrial fibrillation, how the heck is that going to be good for you? I just don't think so, okay? So, anyways. All right, after omega-3 supplementation, the fasting plasma glucose levels increased 22%. That's their fasting glucose levels were up 22%. That's a lot. Okay, I don't really care about their postprandial level. Okay, it's better to undertreat type 1 diabetes with insulin than to overtreat it. Because if you overtreat it, you can drive them into hypoglycemia. They can have all kinds of problems. They can pass out. They can crash their car. They could drive funny, get arrested for DUI. Hypoglycemia can lead them to getting injured. I try to make things easier for type 1 diabetics. I try to treat them with 1 injection of a long-acting insulin like Lantus or Levemir. With improved diet, which means switching to a starch-based diet, I can typically lower their daily insulin dose by about 1/3 to 1/2. Patients taking insulin medications need to keep a source of sugar around to treat themselves if they were to get hypoglycemia. Hypoglycemia can cause symptoms like hunger, shakiness, sweats, confused mentation, grumpy, headache, dizzy, even the flashing lights in the eyes, scintillating scotometer. Okay, dietary fat worsens type 2 diabetes. Next paper here. Dietary fat acutely increased glucose concentration in the blood and insulin requirements in patients with type 1 diabetes. Okay, 7 patients with type 1 diabetes, high-fat dinner required more insulin than did a low-fat dinner. Before 1980, people in China, by the way, everything I'm reading to you is stuff that Dr. Mcdougall wrote. Before 1980, people in China ate 90% of their calories from white rice, and diabetes was very rare, less than 1% of the population. Nowadays, the lecture was given in 2022, China has become a wealthy country, and they eat more westernized type diet, higher in fat. And the incidence of diabetes is increasing. It was, as of 2018, there was 50% of the patients were pre-diabetic and 12.4% were, frankly, diabetic. Okay, so that's a lot. I mean, 64% of the population were pre-diabetic or diabetic. Okay, here we got Walter Kempner. He lived from 1903 to 1997, 94 years. He fed the rice diet to his patients at Duke University in Durham, North Carolina. And he cured 100% of the patients, 100% of the type 2 diabetics. That's a lot. Remember, pills cure 0%. The Kempner rice diet was 94% carbohydrate, 4% protein, 2% fat. That's important for people to see because a lot of people ask me, what about your good fats? Look, you don't need hardly any fat. There's been other studies showing people getting only 1% of calories from fat. They're fine. Okay, Kempner was only feeding them 2% of calories from fat. Okay, and he's only feeding them 4% of calories from protein. So that's pretty low, and the patients were doing fantastic. White sugar was given in larger amounts if the patient wanted to maintain their body weight. The reason Kempner would give them white sugar is because there's no nitrogen in it, okay? It's also, it doesn't have the acidity like fatty acids, proteins made out of amino acids, okay? Carbohydrates not acidic like, fats and protein. Okay, Kempner noticed a decrease in heart size, a reversal of heart failure in some patients, and he recorded hypertensive retinopathy in the eyes being reversed. Rather amazing. Okay, next, Nathan Pritikin. He was Dr. Mcdougall's most important mentor. When diabetic patients ate the Pritikin diet of low-fat, plant-based diet at the Pritikin Longevity Center, their fasting blood glucose decreased a lot, from an average of around 183 to 150, and their need for medications was also markedly reduced. Oh, and then Pritikin said that the American Diabetes Association diet was high in fat, with about 40% of calories from fat, and he said it was designed to guarantee that the type 2 patient will never be cured. Okay, this is a little aside by me in the brackets. I put my asides in brackets. I went to the store, this is many years ago now, about 25 years ago, to look at the food that was specifically, they had a little aisle set aside for the diabetics, because I thought, gosh, they're going to make the best possible health food to give these diabetics. So I went and started reading the labels. It was terrible. It was full of processed food, chemicals and preservatives and other junk. It was terrible food. So I thought that was kind of funny. Because like the patient has the expectation that the whole system is designed to help them, but when you look at it closely, it's not at all. That's why it's funny. Okay, here's the reference, the Adventist Health Study 2. The more plant-based a person was, the lower their risk of diabetes. The incidence of diabetes was the least in the vegans, then the lacto-ovos, then the pesco-veg, semi-veg, and then the worst in the non-vegetarians. Okay, John Mcdougall, MD, he said that, here's what he's talking about, the Mcdougall diet. For somebody eating the Mcdougall diet, the risk of developing type 2 diabetes is essentially 0%. 0%. The Mcdougall diet has no downside, no adverse effects, no additional cost. Most type 2 diabetics can come off all their diabetes meds within 48 hours of beginning the Mcdougall diet at our facility. The Mcdougall diet cure rate for type 2 diabetes is 100%. So Mcdougall's saying his cure rate for type 2 diabetes is 100%. Okay, and then here's Mcdougall continues. He says it's important for patients to realize that fat causes diabetes. How can a patient get better if they don't know that? If they don't know that, then they don't know what they should do. Yeah, so you always want to know the cause, the beginning event. So it's eating a high-fat diet. So you should not do that. And no one should do it, but especially not if you're diabetic.